Hi, today we're gonna do a newborn exam, or part of a newborn exam, we're gonna look at the extremities of the baby. So I'm gonna unwrap my baby. First, I wanna make sure she has full range of motion. So I'm gonna kind of bring her arms up and down, side to side. You're bringing it out about 180 degrees. And she's gonna bring her arms naturally back in because she's gonna wanna flex back. If she doesn't have good flexion, that can be a sign of some kind of neurological impairment. And if you can't move her arm without discomfort, she might have broken clavicles, which can be common from birth injuries, or even broken arm bones. You're gonna wanna feel her arms and make sure that the bones are all intact, and her clavicles, and her wrists. And with the legs, you're gonna just do the same thing. Make sure she can bring her legs out and in. If you're feeling any like clicking or what's called crepitus, that's concerning. You might be feeling like a popping. That means that the hip joints might not be fully formed, or she might have a dislocated hip, which is common especially in breech babies. They've been sitting so long in this position, and their birth with their hips first. They can get dislocated hips very easily, so it's important to make sure you check the range of motion on that and feel if you feel any weird popping or clicking or anything like that. You also want to make sure her legs are all intact, because also with birth injuries, they can end up with broken bones in the legs. That can be common. You're going to look at the creases on her hands, because some genetic anomalies, they end up with a lack of creases, especially like Down syndrome. Sometimes they can have only one crease. It can also just run in families, so it's not necessarily, you're looking for multiple things together to look for things like Down syndrome, but that it can be one of the signs of different syndromes, especially Downs. You're going to want to put your finger in her hand and make sure she has the grasp reflex. You're going to count all of her fingers, make sure they're all there and that they're varying lengths, because having fingers of all one length can also be a problematic finding for different syndromes. A lot of babies might have like polydactyly, like an extra little digit on a finger, and that can just be removed often. Some babies have webbing in between their fingers or their toes, so that also, obviously, the parent's gonna want to be talked to about that and probably have surgery, so that's important to note. You're going to look at the fingernails too, make sure all their fingernails are there. You're going to check the bottoms of the feet for the Babinski reflex, where you run your finger up over their little feet and they spread their toes real wide. That's just a neurological finding. That means that that's normal if her feet spread like this. You could check the stepping reflex, where you put the baby down and they kind of step when they feel their feet pressed on a flat surface. They're going to kind of take steps. And that's pretty much it for extremities. I don't know about any other things you're going to see. You're going to, check for symmetry. Make sure there's no abnormal birthmarks, or if there are, note them. You're going to, sometimes they have some cyanosis in their hands and feet, especially if they're getting a little bit cold. You can reassure the parents that is usually normal, as long as it goes back to a normal color once they're like warm and wrapped up. They should go back. If it doesn't go back to the normal color, it can be a sign of a birth defect, so that's important to note as well. I think that's everything for the hands and feet and for the extremities. There's the Moro reflex. I don't know if that falls under I guess it can fall under extremities since it involves the extremities, where you kind of like let the baby drop. You catch them, obviously. You're not going to just drop them, but you kind of let them have like a little bit of a gentle fall, and their arms should go out. Their arms and legs should go out and then back in, and that is a normal finding, neurological finding for the baby. Yeah, I think that's it. Just want to make sure, you know, that they have full range of motion and that their flexion's good, their tone is good, and that's about it. Thanks.